My name is Dr. Steve Miners of Rehab Effects in Austin, Texas. Today we will be discussing and showing how cold laser can work on certain reflex points. In the previous segment we discussed the Flexor withdrawal reflex. So the application that's going to occur right now is how the cold laser can affect the Flexor withdrawal reflex and allow someone to return to their sport or to work at a faster rate and with less pain. So we're going to actually check the Flexor withdrawal reflex. Quick review. Flexor withdrawal reflex starts in the brain, goes down through the neck and through the spine via the spinothalamic reticular tract, comes out at about, or should I say ends at about the fourth lumbar level in the low back. So in checking this, we're going to have the patient raise their leg, and actually it should be the therapist or doctor who raises the leg as high as possible until you get to the end of that springy motion. You really can't go much further. So you come to here. And this is just short of about 90 degrees at this point. Then you check the other side. And you're going past 90 degrees. There's a little bit of knee bend here, just as there was in the other one. So we have a positive Flexor withdrawal reflex on the right. The way that we can confirm this is to have the patient therapy localize the area where it starts, which is behind the ear, therapy localizing that part of the brain, and performing the straight leg raise test again. And at this point, we come to a little past 90 degrees. That confirms that we do have a positive Flexor withdrawal reflex. As I mentioned before, with the Flexor withdrawal reflex, the reason why we test a straight leg raise is because when it's a positive Flexor withdrawal reflex, the extensor muscles, such as the calf, the hamstring, the butt muscles, go into contraction. They get really tight. And as a result, we realize that that needs to be addressed. So we're going to do that with the cold laser right now. We set the appropriate frequencies and we put the cold laser on that area behind the ear for approximately 30 to 60 seconds. And then we will recheck it. Okay, great. Let's check that. Okay. Without the patient therapy localizing that area as she did before, we're going to check the straight leg raise again. And at this point, she has now gone slightly past 90 degrees, a little bit more than she did before. So this informs us that we are resolving the Flexor withdrawal reflex. So for patients who may come in with a pulled hamstring that they may have suffered during running or some type of sports activity, injured their low back at work or at home, this type of therapy is indicated.